So today we'll be talking about the joints. So at the end of session, students should be able to describe various joints, about their subtypes, examples, explain the concept of nerve supply of joints and the Hilton's law. So what is a joint? The joint means a place where the two things are joined together. So in anatomical usage, joint is the junction between two or more bones or the cartilages which are covering the bony ends. How do we classify the joints? So joints can be classified according to the structure and the function. So what is the functional classification? So depending upon the degree of mobility of the joint, they can be classified as immovable, slightly movable and freely movable. Immovable joints are synarthrosis. They show no mobility. For example, sutures. Slightly movable joints shows some degree of mobility. For example, secondary cartilaginous joints, syndesmosis. The above joints are without any cavity. So the two joints that are synarthrosis and amphiarthrosis are without any cavity. Now the third type is the freely movable joints or diarthrosis, shows the maximum degree of mobility. So they can be structurally classified as fibrous, cartilaginous and synovial, and functionally classified as movable, slightly movable and freely movable. So fibrous joints are synarthrosis type, cartilaginous are amphiarthrosis and synovial are diarthrosis type or freely movable. So fibrous joints can be again subtypes of fibrous joints are the sutures, syndesmosis and gomphosis. Cartilaginous are primary cartilaginous joint and the secondary cartilaginous joint. They are the fibrocartilaginous joint. Primary cartilaginous joints are covered by the hyaline cartilage. So depending upon the tissue present between the two joints, we can classify them as fibrous, cartilaginous and the synovial type. Synovial, according to the number of bones, they can be simple, compound or complex. According to the axis of movements, they can be uniaxial, biaxial, polyaxial and the plain synovial joint. So structural classification, we have done fibrous, cartilaginous and synovial. So depending upon the type of connective tissue present between the joint, we can classify them as fibrous, that are the sutures, the cartilaginous and the synovial type. So fibrous connective tissue between the two bones are the examples are the sutures. Then cartilage between the two bones are the amphiarthrosis or the secondary cartilaginous joint, and the synovial type between the two bones there is a synovial cavity filled with synovial fluid and covered by a fibrous capsule. So first is the fibrous joint. They lack the joint cavity and they are of three types: sutures, syndesmosis and gomphosis. So first is the sutures. So sutures are connected by thin connective tissue. They are confined to the skull. They are immovable joints and they are classified as synarthrosis. So the sutures between the bones of the skull, they are the type is the sutures are the fibrous type of joint. Then second type is the syndesmosis, which is connected by the two bones are connected by the dense fibrous connective tissue or the interosseous membrane, and small amount of movement is possible between the articulating bones. They are classified as amphiarthrosis, slightly movable joints. Example is distal tibiofibular joint. So distal tibiofibular joint is an example of syndesmosis. So the two bones are connected by the interosseous membrane. Now the third type is the gomphosis or peg and socket variety. It is the cone-shaped root of the tooth fixed into the socket of jaw, and it is classified as immovable or synarthrosis. So this is the peg and socket variety of joint. This is the enamel and dental or tooth fits into the socket of mandible and maxilla. So this is the alveolar socket and this is the tooth. So the variety is called as the gomphosis. Now the second type is the cartilaginous type. So the presence of cartilaginous tissue between the two bony ends, we can classify them as the synchondrosis and the symphysis. So synchondrosis is also known as primary cartilaginous joint. Here the connecting material between the two bony ends is the hyaline cartilage. So these are the two bones and the plate of hyaline cartilage separates between the two bony ends, and this is the type of primary cartilaginous joint. So between the joint between the epiphysis and the diaphysis represents the synchondrosis. So examples are epiphysis and diaphysis of the developing bone, and they are joined by the epiphyseal cartilaginous plate, the first chondrosternal joint, and the joint between basi-occiput and the basi-sphenoid of base of skull. Now the symphysis, the secondary cartilaginous joint or the fibrocartilaginous joint, they are permanent, persist throughout the life, and for example the type of cartilage present between the two bony ends is the fibrocartilage here, and it is the amphiarthrosis, the slightly movable joints. So this is the secondary example of secondary cartilaginous joint or symphysis. So this is the pubic symphysis. These are the two bony ends, and this is the plate of hyaline cartilage and the fibrocartilaginous disc in between. So this is the pubic symphysis representing the symphysis type of variety of joint. So examples are symphysis and the manubriosternal joint and the joints between the two vertebral bodies, that is the intervertebral disc. Now the third variety is the synovial joint. So synovial joint is covered with the bony ends are covered with articular cartilage with the presence of joint cavity lined by synovial membrane enveloped by the articular capsule. So they permit free movement called as the diarthrosis. So this is the bony ends covered with the hyaline cartilage, and you should know that this hyaline cartilage is devoid of perichondrium and cannot regenerate. So if there is any injury to the hyaline cartilage, then it cannot be rejuvenated and it is replaced by fibrosis. So this is the articular cartilage, articular hyaline cartilage. This is the capsule, and inner side of capsule is covered by the synovial membrane, which secretes the synovial fluid in the synovial cavity. So what is the structure of synovial joint? The articular surface is covered with the hyaline cartilage. So articular cartilage is avascular and non-nervous and elastic. So it is lubricated with the synovial fluid, which provides nutrition, and it provides slippery surface for the free movements like ice on ice. So surface of the cartilage shows fine undulation filled with the synovial fluid. So it is devoid of the perichondrium, hence no regenerative power. So the replacement is possible only by the fibrous tissue. So this is the two bony ends covered with the articular cartilage, and this is the joint cavity covered by the synovial membrane and the capsule. So articular capsule covers the bony ends and it encloses the synovial cavity. It is made up of the dense irregular connective tissue having the collagen fibers attached to the periosteum of articulating bone and close to their articular cartilage. Synovial membrane is the thin vascular membrane of connective tissue that secretes the synovial fluid, and articular cartilages are not covered by synovial membrane. It secretes the synovial fluid which lubricates the articular cartilage and fills the synovial cavity. It has got phagocytic cells that removes the microbes and the debris from the joint cavity. So when the joints remain immobile for some time, it becomes synovial fluid becomes more viscous, and as the movement of the joint increase, the fluid becomes less viscous. So we need warm up before the exercise. So articular disc and menisci. So some synovial joints, they contain the fibrocartilaginous disc between the articular surface of two articulating bones. So there is an articular disc attached to the inner surface of the fibrous capsule and divides the joint cavity into compartments. Different movements are possible in different movements are happening in these two compartments. So this is the articular disc which divides the joint cavity into two compartments. This is an example of temporomandibular joint. So synovial joints can be classified according to the number of bones into simple joint, that is only two bones they form the joint, for example finger and toes. The compound joint, that is two or more bones forms a joint, that is tibia and fibula. According to the axis, the main three type of axis: anteroposterior, transverse and vertical axis. So we can classify it as uniaxial or hinge joint. The surface is convex. One surface is convex and another is concave. So this is hinge joint working around the transverse axis. For example, interphalangeal joint, elbow, ankle and finger, the toes of finger and toes. Now the pivot joint, it is the rounded axis, rounded surface which fits into the ring, and there is a vertical axis where the movement is happening. So rotation movements are happening here. So superior and inferior, radioulnar joint and atlantoaxial joints are example of the pivot variety of synovial joint. Then condylar variety, it has two condyles, lower end of femur and the condyles of mandible. So it has got two condyles which are fitting into the concave surface of other bone. What movement is possible here are flexion and extension around the transverse axis and slight rotation around the vertical axis. For example, the knee joint and temporomandibular joint. So this is the femur, this is the tibia, this is the condylar variety of synovial joint. So knee joint is seen in the sagittal section, then it is seen in the coronal section. These are the two condyles and this is the articular cartilage and this is the joint cavity. Now the biaxial type, ellipsoid variety. So ellipsoid are wrist, metacarpophalangeal and metatarsophalangeal joints. So flexion and extension takes place around the transverse axis and abduction adduction around the anteroposterior axis. Now the saddle joint, the first carpometacarpal joint of thumb and sternoclavicular joint are the saddle variety of synovial joint. So it is the articular surface is saddle shaped and it is fixing into the concavity of the reciprocal bone. So the reciprocal convex surface fits into the other convex surface of the bone. So this is saddle joint, the first carpometacarpal joint. Now the multiaxial joint is the ball and socket variety of synovial joint, for example hip and shoulder. So what movements are possible here? Flexion, extension, abduction, adduction, rotation and circumduction. So the rotation is, the movements are happening around the multiple axes. So it is the multiaxial joint. This is the head of femur fitting into the acetabular cavity and this is the head of femur. This is the acetabulum of the hip bone. Now the plain joint, only gliding movements are possible here. For example, intercarpal, intertarsal joints. So intercarpal and intertarsal joints, the plain synovial joints. So what movements are possible in these joints? The gliding movements, angular movements and rotatory movements. For example, spin, slide and roll. So what movements are possible? Here on the joints, flexion, that is bending, then extension, straightening, abduction, movements away from the midline, adduction away from towards the midline, circumduction, combination of flexion, extension, abduction and adduction. Then rotation around the long axis of the bone. Pronation, supination, inversion, eversion, protraction, retraction, elevation and depression. So what is the blood supply of the synovial joints? It forms the periarticular network of arteries surrounding the joints. So network is formed by the arteries present in the neighborhood of the joint, the vicinity of the joint. It supplies the capsule, synovial membrane and the epiphysis. What is the nerve supply? So it has got rich nerve supply. So nerves supplying the joints are of three types: the sensory nerves conveying pain, then sensory nerves conveying proprioception, and autonomic fibers which has vasomotor effects. So what is Hilton's law? So Hilton's law states that the nerve supplying the joints also supplies the muscle surrounding the joint. So it regulates the movement of the joints and the skin over the joint. So the nerve which is passing through the joint will also supply the muscles surrounding it. This is called as the Hilton's law. Now what is disc prolapse? So the intervertebral disc has got nucleus pulposus and annulus fibrosus. Then if the nucleus pulposus is coming out of the disc, it will compress upon the nerves which are exiting out of the intervertebral foramen, and they cause the clinical condition called as the sciatica. So that causes radiating pain in the lower limb. This is called as sciatica. So this is the formation of intervertebral disc. This is the nucleus pulposus. This is annulus fibrosus, and this disc is coming out and compressing upon this nerve, causing the sciatica. Degenerative changes or spondylitis may occur in cervical spine, leading to narrowing of the intervertebral foramen, causing the pressure on spinal nerves. What is dislocation and what is subluxation? So dislocation, when the joint gets dislocated, the bone forming the joint no longer remains in the contact with the other bone. So if there is no contact, it is called as dislocation. So for example, the mandibular joint, temporomandibular joint, the shoulder joint and hip joint. Less commonly hip joint because it is stable as compared to the shoulder joint, because the surface area which is making contact with the reciprocal surface is more as compared to the head of humerus in the shoulder joint. So the shoulder joint, acromioclavicular joint, temporomandibular joint are more prone to get dislocated. Subluxation, when the articular surface only have partial contact with the other bone. So this is subluxation, when there is partial contact, and when there is no contact, it is called as dislocation. Now rheumatoid arthritis, it is the inflammatory systemic disease which involves the synovial membrane of small joints of hand, and due to chronic inflammatory process it leads to deformity. So joints may get inflamed and it is called as the rheumatoid arthritis. The second type of disease which can occur here is the osteoarthritis. So it's a degenerative condition of the large or weight bearing joints. Rheumatoid arthritis was of small joints. Osteoarthritis involves the weight bearing joints and it wears out, degenerates. There is formation of osteophytes and the patient feels lot of pain due to rubbing of bones due to when there is some movement. This is called as osteoarthritis. So if the joints has been diseased for a very long time, there is no hope of recovery, they can be replaced. So this is the X-ray which shows the replacement of joint. So this is the hip replacement and this is knee joint replacement. So this is the replacement of the joints. So that is all for today. These are the references. You can refer to these books for if you don't understand anything, you can refer to these books. Thank you.